Hi, I'm Valentin and I'm a HDU nurse and a BLS trainer in my hospital. These are the skills that can save someone's life and one day it might be someone you care about. So today we're looking at how to recognize a cardiac arrest. So if you witness someone who collapsed, try to talk with them, shout in both ears. Maybe they have a hearing aid. So, hello sir, can you hear me? Can you open your eyes? If they're not answering, you can give them a trapezius squeeze. If the person is not answering to verbal or painful stimuli, that means it's a severe situation, could be cardiac arrest. So the main thing we have to do, we need to dial 999, tell them it's a cardiac arrest, adult cardiac arrest, and then carry on with your assessment. My advice is you can put the phone on speaker. They might tell you where is the nearest NIFIB or the ambulance on their way. So you know your level of stress is going to diminish a little bit. Right, so after we've done our assessment, we realize something is wrong, we call the ambulance. Now what we're gonna do, A, B, C. Around 40% of the patients in cardiac arrest, they might vomit as well, yeah? So what does it mean? They have vomit in their mouth. If we tilt the head straight away, that means the vomit will go down and they'll aspirate and make the situation worse. So in A, what we're gonna do, check the mouth, yeah? If there is something there, if we can clear it up, you just put the head on the side. So we turn the head, clear it up. That's the only thing we can do. We can't do too much. If we can see something, we never stick our fingers there. You know, if they catch your teeth, just in case they are semi-conscious, you know, you might end up just with 4 fingers. So be mindful. And then what's going to do the next step? B. So we've done A. So A, remember, in A we just check the mouth. Yeah, that's it. Clear it if we can. B, breathing. So what we're going to do in breathing? I don't know if you heard about head tilt chin lift. So left hand on his forehead, right hand on the chin. So tilt the head, hyperextension of the head. Why are we doing that? Head tilt chin lift. So tongue at this stage when the person is unconscious is a muscle, right? So when the person is unconscious, the tongue falls back and closes the airway. When we do this, if you try to swallow with your head hyperextended, you cannot do that. So the same, the tongue is, the patient is unconscious, the tongue is obstructing the airway. So when we do this, it's not obstructing the airway. And now we can assess the breathing. So in B, what we're gonna do, it's a maneuver called look, listen and feel for no more than 10 seconds. Yeah, look, listen and feel. So what we're looking at the chest to see if there is chest rising. Listening, try to listen any gargling, any sounds, yeah? Or try to feel the air on the cheek. So of course you're gonna open the chest, the clothes, yeah? Look, listen and feel, and we shouldn't exceed 10 seconds, yeah? So what we're trying basically to do, head tilt chin lift, we're trying to see if the patient is breathing, if he's alive, yeah? If we done this assessment and we realize within 10 seconds is nothing, sometimes you can hear like an agonal breathing, it's called. Agonal breathing means it's abnormal breathing, it's just the patient is still kind of nearly dead. The brainstem cells and the lungs, there is still an electrical connection. So that's why it's happening, this kind of agonal breathing. You can find it on YouTube apparently, something like that. So within 10 seconds, if you do this, it's just like a gasp of the body for the air. If you hear this, it's not a normal one. So don't mistakenly think the patient is breathing, yeah? So head tilt chin lift, 10 seconds, the patient is not breathing. And then we go to cardiac arrest.